Welcome to this week's In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh. Thank you very much for joining me on this week's In Focus. We're going to have a chance to speak with Wayne County Health Department Executive Director Christine Stinson. And originally when I reached out, COVID was part of the things that I was going to talk about, but it seems to continue to take over the conversation at times. And trust me, it's not because we want it to. We really want to be able to talk about other things. There's a lot that encompasses the Wayne County Health Department and public health in general. And we'd really like to get to some of that, but let's welcome in Christine. Thank you very much for taking some time and talking with me.
Sure, thanks for having me on, Eric.
We are doing this now. We're actually recording this a week before it will air, just so if some of the things that we're talking about change between now and then, that's why. We want to start with COVID, but that seems to be where we are. Yesterday, which was let me check a calendar here so that I don't misspeak, the 11th of August, we went from blue to yellow, which means things are progressively getting worse for us. Talk about what you're seeing, talk about the changes that you're seeing, particularly since we were on the air 2 weeks ago in a special Live in Focus. Dr. Jetmore, Dr. Huth, yourself, and we were still a blue county at that point. We were seeing things get worse. We're a week from that, and it is still progressing on a downhill trajectory. Talk a little bit about what you're seeing.
Yeah, we were one of the very few counties that were hanging on to that blue distinction, and we've lost it. We now are pretty much in a free fall, and our numbers have went from having just a couple of weeks ago 3 to 5 cases a day to having we had 31 cases yesterday, and we had 32 cases today. So we went very steep upward in our case count, and school just started. So I expect we will jump quickly into orange, and if we continue, we'll go red quickly with the rest of the state. That's my prediction. And
you don't mind if I hope you're wrong about that, do you?
Oh, I would love to be wrong. I really would love to be wrong. But I don't see without some changes that we will be able to change the trajectory that we're going in. I really don't see how that we'll be able to stop how we're going. But there are things that we can do. There are mitigation strategies that we could put in place now that could stop that. We have been seeing an uptick in vaccinations, but we need to see a whole lot more people vaccinating. We need to see more people wearing masks indoors. I don't think that there is really a reason to wear masks outdoors. But really, when you're indoors, especially in tight situations, you need to put your mask on.
Christine, that indoor mask recommendation is one that you're putting out there or recommending, and it's not a mandate, but it is a recommendation. And you're recommending it for people regardless of their vaccination status. Is that true?
Yes.
Are you getting pushback from vaccinated people saying, look, we did what we were supposed to do, we're still getting penalized? What's the deal?
No, I really am not getting I'm not getting pushback. I may get, a question of, so why are we going back into masks? And then when we get explanations, I see way more people that get vaccinated understanding why we have mitigation strategies to stop the spread. I think that they understand why we have mitigation strategies and what vaccinations mean. And so it's unvaccinated people that are not understanding what mitigation strategies mean. And I'm not sure that they want to understand mitigation strategies and what vaccinations mean and what they do, and why we vaccinate and why we do the things that we do. And there was a really funny TikTok thing that a ER doctor done that talked about, when you put a seatbelt on and you get in a car and you drive, that doesn't mean that you're not going to get in a car wreck and then still have to go to the hospital, but just because you're still not going to get injured in a car doesn't mean you're not going to put a seatbelt on. That'd be silly to think that. It's a mitigation strategy that you do. That's why we vaccinate, and that's why we still put masks on. They're called mitigation strategies. And that's what vaccination and masking are. They're mitigation strategies. And they're strategies that we do that help us to not overwhelm our healthcare strategies. And they're mitigation strategies that we do to help protect our people that cannot get vaccinated, like our children and like our population that are immunocompromised and can't take the vaccine. So that's why we do what we do. And that's what they're called, our mitigation strategies and non-pharmaceutical interventions.
We talked about this a couple of weeks ago when we had a chance to talk. You have worked very well, your department has worked very well with the superintendents in and around Wayne County during last year when things were hybrid. There were kids at home, there were kids in class. It was a back and forth type situation. The executive order that is out right now really puts the onus as to whether to mask up in schools on the superintendents. Mm-hmm. So the superintendents and the school boards are making that final decision, but you're still having contact with them. You're still talking to them. What is it that from a health department standpoint, you're suggesting? And I'm asking that particularly in light of the fact that one of our area schools was not able to go to Band Day. That was not the only school. There were at least 3 schools who were not able to participate in Band Day. How do we get through these next few months when people will begin to be indoors more? There'll be more indoor sporting events and things like that taking place. What are your suggestions for them?
Right. And I think that is really important. Thank you for allowing me to talk about that. The governor's executive order put that policy and that mandate on the school boards on masking. And so it's up to the school board to put their policies on public health in place, not the health department. So I can't mandate that the schools have good public health policies. I can talk to them about what a good policy would be. And we've said that right now, while the Delta variant is surging, your policies should be, a good policy would be that everyone be masked right now. Regardless of vaccination status, everyone should have masks on indoors. Everyone should have masks on indoors. Staff, teachers, and students should have masks on indoors. That's our guidance to the schools, is for everyone to be masked indoors. So that's what we have talked to the schools about. So if you're hearing something else from coaches, from teachers, from principals, that the health department has been silent on the guidance, that's incorrect. Our guidance has been everyone should have masks on in the schools. But what they have, the governor has allowed them to have what they feel is the best policy. And that's for them to decide. They have came together with their school boards and their teachers and their principals, and they came up with their policies. And that's what works best for them. And we support them. And that's the way that it's going to play out. But we'll continue to provide them with the best guidance and with support in how to contact trace, and with whatever it is that they need. We're here to provide them with whatever support that they need.
So would the health department, if contact tracing was necessary, would the health department be doing that, or does that also fall to the schools to deal with?
So the schools, every morning we have the contact tracer that looks through our system and pulls out all of the school age children. And we send those names to the schools and said, here's a list of school age children. They look through that and they pull out the kids that are in their school, and they do the contact tracing for the kids that are in their schools. So they're responsible to contact trace their schools and pull out and do the contact tracing of who's had contact with those kids in their schools.
When COVID started, we were seeing older individuals. We were very much worried about those people that were 70 plus. And it has gradually moved. More and more, I'm beginning to hear news stories of younger people, people in their 20s, people in their teens, people as young as 8, 9 years old in the hospital, very serious illness, on ventilators even, with this Delta variant. Talk about if we're beginning to see some of that locally. Is it getting to be that young here?
I have not heard of any pediatric cases at Reed. And Dr. Huth stays in contact with the health department. I think that we would be notified of very seriously hospitalized children. That's not to say that we don't have some very, very sick kids that are staying home and having some serious illness with COVID. And it's not to say that we're not going to have some long haulers with COVID, with this illness. So it's nothing to mess around with. I don't think that it's something that you want your child to get, because we still don't know the long-term effects of having COVID-19. Mm-hmm. So, and it's something also that I've heard and I've read some stuff about when we think about like chicken pox. Usually the first kid that gets chicken pox has the most mild case of it. And then that third and fourth kid in the family that gets chicken pox, boy, they are the ones that gets the sickest with it. And so in households, you want to be real careful of that third and fourth kid that gets it in that household, because they're getting, triple and quadruple doses of COVID-19. So when you get COVID-19 in the family, open windows up, air out the house, make sure that everyone's not all tightly sealed up in the house and convalescing, because you're going to get, double and quadruple doses of that. And someone could get very, very seriously ill. So increase ventilation inside your house when you are dealing with the illness and convalescing.
Good advice. We're going to be moving into the months where things begin to cool off, and maybe that's going to be a little bit less likely that people will be able to open up as much. You're suggesting that this upward or downward, depending on what you're looking at, trajectory is going to continue. Talk about what you're seeing and why you think this slide is going to continue. Because one of the conversations, one of the thoughts from when we were together a couple of weeks ago was that maybe with this Delta blip, it would be 1 or 2 bad weeks, maybe 3, and then we'd see things get better. In some states, that's not happening. Why do you think Indiana, and particularly here in Wayne County, we're going to continue that slide?
I think our low vaccination rates is going to be one of the things that will drag this on for several weeks because we do have low vaccination rates. We didn't see an uptake in vaccines the way that we should have seen the uptake in vaccination. So we're going to see a prolonged outbreak, just the way that we knew that we would see in states that had low vaccination rates that we saw in Indiana.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, having some time with Christine Stinson, Executive Director of the Wayne County Health Department. Christine, a couple more things with COVID, and then I want to move on to some other things in your office, because
Sure.
This is not all that the health department does and focuses on. The sporting events are about to kick off. We haven't yet had our first football game. Wrestling, things of that nature. You talked about what you're suggesting for in school. Have you also had conversations with superintendents, board members about sporting events and what that can or should need to look like? Granted, you're outside for a football game, but if the stands are full, if people are yelling, that's still allowing a lot of particles to leave people's mouths. I mean, we get excited when we go to sporting events,
We do.
Does that open up the possibility of this spread continuing? And have you been asked that question, and what are you telling the authorities?
I haven't been asked about it. I think that we'll probably advise, masking, at the events, maybe reduction, not 100% at them, maybe a 50%, depending on the caller. If we're red, maybe go to 25%. I don't think anyone is in favor of no seasons at all. And I don't think any of us are in favor of no fans in the stand. I think that there's not an appetite for, shutdowns and things like that. So I think that there is a way to have things, at reduced capacities, or masking at events, and different ways to go about things. And we'll work with the athletic directors in the schools to see how we can do it. Each venue is different, and each athletic director is creative, and we can see how we can get these events in and have parents and family and fans at these events.
Regardless of what level we're at, blue, yellow, red, at any point, does the authority to make decisions come back to the health department, or does it always stay with the schools?
That's a really good question. I think that it should always be a collaborative, regardless of where that authority ultimately lies. I think it should be in collaboration with the school and the community, because ultimately, it's in the best interest of the community to have events, and but it always is also in the best interest to hold them safely. So I think that what I've learned about this community is we want to have a safe community. So I think that we would always, regardless of who's a quote unquote authority it is, that we would work together in collaboration.
Besides the schools, you have a lot of conversation, obviously, with those leaders in government, whether it's the Wayne County commissioners. I assume the mayor of Richmond reaches out to you. I don't know.
Yeah.
If you talk to councils from other towns. Some of those meetings that some of those members are having are in person. Some meetings are still being held via Zoom. What are you suggesting for the government complex at this moment? Are you suggesting Zoom meetings continue, that they begin to limit once again the number of people that can attend meetings? What are your thoughts on how those things should go? Because those meetings can draw a number of people, particularly now. All of our communities are working on their budgets, and that's something that really does bring people out in discussion.
I think that that's something that will be discussed at the health board meeting, and that's more of a policy discussion that I'll leave up to the board to make that decision on what should be put forth from the board, and that'll be at Thursday's meeting.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. Maybe it's a Sunday morning and you're listening to the audio on ESPN Radio 100.9 or 1490 WKBV, as well as G1013. However you're seeing this or hearing this, we appreciate you tuning in. I'm Eric Marsh. We're speaking with Christine Stinson, Executive Director of the Wayne County Health Department. Christine, I know COVID has been a big thing really since you've come to town, and this has been a year and a half or so, you being in town, and this being the main topic of conversation for all but maybe 6 weeks of your time in town. But you've had a chance to move the health department office, physically move the health department office, do some renovations in the health department office that you moved into. You bought a mobile unit. You've had to learn the community and some other things going on. Let's talk about your mobile unit. It's getting out there. It's giving COVID vaccines. It's giving other vaccines, and you are heading squarely into flu season. There wasn't a flu season last year, but we don't know what's going to happen this year. Talk about when flu vaccinations will begin, where those are being held. Are you already working on clinics? Talk about that.
Yeah, so we will be holding flu clinics. Those usually start around the 1st of October, and we'll be working to bring those out to employers more than we did last year. Last year was very COVID focused and forward facing, as it should have been. So hopefully we'll be able to be a little more focused on flu, but it COVID really sucks the air out of the room. So we will also be focused. That'll drive the bus, so if we're still driving that will drive us, but we will, we'll be out in the community with our mobile unit. Right now we're out at a lot of the schools doing back to school clinics. We were at Star Elementary and Test Middle School this week doing those and did great clinics there. I was really, really proud of how well attended those school clinics were this week with that, and was just so proud to see that mobile unit rolling up to those schools and all the kids coming out and going on that bus, and so we're really, really happy when that gets out. It's also used twice a week going out for our harm reduction program, so it serves the community very well with the harm reduction program. Those are on Tuesdays and Thursdays. We have a program on the east side and then a program on the west side with the mobile unit.
When you say harm reduction, specifically, what are you talking about?
It's our harm reduction program. There's a lot of different things that we do with harm reduction on that. And so if anyone wants to learn more about our harm reduction program, I encourage them to stop over here and we'll go through everything that happens with our harm reduction program, and including testing and treatment. And we have Meridian Health Services that come over here and talk about treatment and different programs like that go along with that. so that's on Tuesdays and Thursdays that we roll out. And that's, we use the parking lot of Phillips Drug Stores on the east side and west side for that program. And then, so that's when the bus is being used for immunizations on that. We are going to be on the 22nd at El Fuego. I think I'm saying that right. On the 22nd doing immunizations, and that is at 1520 North A Street. And that's going to be from noon to 2 p.m. on the August the 22nd. That's the last time that we have the bus scheduled to go out for immunizations. But we will be continuing to schedule to go out in September. And then in October, we'll start to schedule, and we'll have flu vaccine on the bus and start doing flu shots. But that's in October that we begin to offer flu vaccines.
At one point earlier in the pandemic, when things were definitely more shut down, people weren't able to do regular doctor's appointments, things of that nature, there was a real concern that many of our children were not being able to get their regular vaccinations, have nothing to do with COVID or anything else. And have you been able to see in your conversations with local pediatricians or with people coming into your office, are those vaccination numbers beginning to ramp up again to a point where you're comfortable? Because that was a very big concern of yours at one point.
Yeah, we're seeing that we're catching everyone up. Every Wednesday we have extended hours for school shots, and we'll be running that through September. And so anyone that needs to be brought back up, they will be able to just walk in and get brought back up to on their school shots. And so that will bring everyone back up, because you do have an exclusion date with your schools that if you're not up to date on your shots, the schools exclude you on your childhood immunization. So everyone should be back up to speed on all of their required immunizations by September exclusion date. And it's somewhere around the third week of September is your exclusion dates for schools. So parents should be wary and ready and aware of those exclusion dates. The schools should be sending home the notices to the parents of hey, your child needs a shot, get to the health department, get that shot. We take almost every insurance. It's really rare if we can't give the shot. If you don't have insurance, we will take your child. If they have Medicaid, we definitely take the child. If you have private insurance, we take those insurance. So come to the health department. We can get your child satisfied and up to date on their shots. And like I said, on Wednesday from 5 to 8, we take walk-ins. So.
Okay, I was about to ask you to say what those extended hours were, and your address for those who don't know.
100 South 5th. We are right there at the corner of South 5th and South A.
Okay. Talk about your environmental health unit. What do they do? What are they focused on?
Well, we have a lot of different divisions in the health department. And probably the one that most people are familiar with is our food inspections. And it's the one division that affects everybody in Wayne County and most visitors through Wayne County. Most of the time when someone comes into Wayne County, you're going to stop somewhere and get something to eat or drink. And our program has touched them through our inspection programs. So everyone that lives here, you've stopped somewhere and gotten something to eat, either at a grocery store or a restaurant. And our inspectors inspect every restaurant and grocery store at least twice a year. And if you watch the commissioners' meetings, you know that we have put before them a new ordinance for them to adopt. And then right now it's in public comment phase. And if you go to the health department's website at www.co.wayne.in.gov, you can review the draft ordinance and see that. And we've got that on their agenda for that. And we're trying to go to a new menu-based ordinance that will, like a gas station that only has soda, like a fountain soda pop machine, and coffee and cheese, like string cheese and stuff like that. That's really, it's got some hazard, that you want to check, but maybe you only want to check that once a year. And on complaint, someone complains that the soda pop machine's really dirty, get in there and take a look at that. Or a restaurant that cooks the food from raw product and then cools it down and reheats it and then holds it all day at hot holding. That's got a lot of variables that you want to take a look at a few times a year. There's a lot of times that it's called critical holding points, that a mistake could happen and could get a lot of people sick. We want to go in there and check on them several times a year. So this ordinance would call for us to do more inspections a year than 2 times a year. So, it would be a menu-based inspection frequency. So, that's
what was your thought process about bringing this forward? Were there problems that you were seeing? Did you just think it was time to make a change? Talk about what the impetus was for you creating this new food ordinance for them.
Well, currently we don't have an ordinance. So that was, kind of one of the things before COVID hit that I did was I said, okay, I want to look at all the ordinances that we have and let's review them. Let's kind of, what's old and not working anymore, what's out of date, what's a good ordinance, what don't we have to worry about. And, I realized, we don't even have an ordinance, which is kind of, it's okay. You don't really have to have one. You just adopt, or you're just working out of the state code, the 410, law, and that's fine. But an ordinance allows you to have enforcement guidelines that allow you to work through the court systems and gives you some parameters that everyone knows, kind of the thing, who you regulate and stuff like that. Everyone kind of knows how you're going to proceed through things. And so it makes it a little nicer for everybody, including your staff and everybody. You kind of know the playing field, and so I thought it was important that the food code, since it is probably your largest division, that was the first ordinance that we should do. So that was why I thought that the food code was the first one that we should probably do, or the food ordinance was the first one that we should do. So that was my thinking behind it.
One of the other areas that you all touch, and again, you all touch a lot of areas in and around Wayne County, are septic systems.
Right.
This is a rural county. We think enrichment of Richmond Sanitary District, but there's a lot of area that don't have that. Talk about how you all handle septic systems, how important they are, and what exactly you all do and are responsible for in that area.
Oh, Eric, I would need an hour and a half to talk to you about septics, and I would only be scratching the surface on that. Septics, or I like to refer to them as on-site sewage systems, are something I have an absolute passion about. It's really what I came from, as far as it's what I used to do. I came up in public health doing septic systems, And so I have a real passion for doing septic systems correctly. And I have a vast knowledge base on them, and I love to talk about them. I love to do trainings on them. And the thing that I love the most about them is teaching homeowners about them. And because once you put them in the ground, everyone wants to forget about them. But they are an amazing thing. They are a living, breathing, green technology that is taking our waste and treating it, and they're eating pathogens and treating that and putting it back into the waterways. And it's an amazing process. So, one of the things that I hope to do is to bring some classrooms to Wayne County. And so the homeowners that are living on on-sites or thinking about buying a home that has an on-site system, before they buy that property, they'll be a smart consumer. And so they'll know what they're buying, and they won't 2 months after they buy a house think, I wonder where my septic system is. And then realize, oh my gosh, I have to put a new septic system in, and it's going to cost me $30,000 to build one, and to be shocked at how much one of these systems cost.
Can you buy a house that has a septic system and not know where it is? I mean, isn't that a prerequisite?
Oh, there's no prerequisite. There's no prerequisite. And it's funny that you say that, because we could write an ordinance that requires an inspection of the septic system before a house sells. And I think that is a wonderful thing for people to have. I think that, because most people think, well, how can you sell a house without at least having your septic system inspected? Shouldn't everyone know the condition of a septic system before the house is sold? Most people think that the health department knows where your well is. Nope. We have nothing to do with wells. But don't you think we should?
Nothing to do with wells.
We have nothing to do with a well.
How's that possible? It's water, it's on property.
Don't you think we should?
I'm going to have people saying that I'm trying to overregulate things, so I'm not going to travel that road.
Well, I mean,
I would have just thought that would have been part of what it is that you septic systems, wells, inspection. Thought would be those are all kind of rolled in together.
Don't you think a well should be tested before you drink it?
I would like mine too if I had one. Yes.
Oh, there's no requirements in Indiana that water be tested.
Okay.
Yeah. The more you know, you just like.
You're watching In Focus on WGTV Channel 11. We're spending some time with Christine Stinson, Executive Director, Wayne County Health Department. Your vital records area, I will say that until I started talking to you, I did not realize how important that particular area is, particularly here. I grew up in another state. Records are handled a little bit differently. Talk about, particularly for those people who have moved into our area from someplace different and things are handled differently in different places. Talk about your vital records area and how people connect with you about that and who would need to connect with you about that.
Yeah, I think that their division was appropriately named vital records. Yeah, because they're vital, Everybody needs a birth certificate, and at some point, everybody is going to need a death certificate. So they hold, if you were born in Wayne County, that division holds that record, and they will hold that record forever. It will never be transferred, no matter where you go in this world, and the places you will see, it will always stay right here in Wayne County, and it will be protected. it will be guarded. It will be always here in Wayne County. And a lot of people think, oh, but I moved out to California when I was 2 years old and I was adopted. But it will always be held right here. Your birth record is always held where you were born. Same with wherever you die. It doesn't matter where you were buried. It was where you died. That record will be held right here. So it gets confusing and it gets really, really mucked up. We get a lot of people that get really, really angry when we won't release a birth certificate, and because they don't have, the required documentation. But you have to think about it. We are the foundation of identification, and we take that very seriously when you're talking about identity theft and everything like that. Every agency that provides, a driver's license or a passport or whatever, it is that require a birth certificate, we are that foundation. So, there's a lot of different documents that you can provide to us to get that. And we'll release a birth certificate to a mother, a father, a sibling, with their required documentation. But we do require a lot of documentation in order, to release that birth certificate because it's such an important foundation document.
There are help wanted signs up all around this area. You can't turn your head anywhere near a business that has a sign in front of it without seeing hiring, help wanted. Talk a little bit about your staff. From a professional standpoint, are you having difficulty keeping your staff at full capacity?
We are fully staffed. Sometimes it's hard to keep our clinical staff, that's a little harder. Our environmental staff, we have a very stable staff of those. We had some health take out some health problems, take out one of our staff members, and we wish him, a very, very speedy recovery there on that. But our clinical staff, it's hard to keep, licensed medical people. And so that's hard to keep people in that capacity. And then we just need so many, we keep expanding our staff, as far as that go with COVID. So that's hard to keep. And we're getting ready to expand testing again, so I need a couple of people for that. So, that's what keeps us, we keep expanding and contracting, as far as that goes with that.
We're back around to that topic again. So talk about, you just mentioned you're about to expand your testing again. What do you think that will look like? Will that be held all in how? Let me try this again. Do you foresee a need to expand testing and vaccination to the point where you're going to go outside of your building or your mobile unit again? Do you see moving back into the Elder Beerman building or something like that being necessary because of where we're going?
I think that we've decided we'll move testing back over to Elder Beerman. This building's too small. I've already outgrown this building. So our throughput for testing, especially with the Delta variant being so contagious, I don't want to bring more people in here as far as staff goes. I just don't have enough room for the staff that I need to do testing. So I'm going to move, and I'm hoping to have it moved by Monday. What would that be? The 16th, over into the Elder Beerman building. And so since it'll be a walk-in, they'll walk in and then come right back out for testing in the Elder Beerman building. It still will be by appointment, so they'll have to go to the scheduling.coronavirus.in.gov, schedule an appointment. But I am expanding, and I'll have more people doing testing. So there'll be more appointments available for people to have.
Will vaccinations also move to that spot, or is that going to remain just kind of in your building?
Vaccinations will stay here at the health department. So
Okay.
testing is the only thing that's moving over there at this point.
At this point.
I'm staying fluid, Eric. At this point, it's staying here. I'm not going to say it will never move over there. At this point, I can keep my vaccinations here.
Okay. I'm probably missing 2 or 3 things, so I'm just going to ask. Obviously, I've asked about vital records, public health nursing. But talk about some of the other things that you all do that maybe I have not thought to ask you about. We got a few minutes, so I want to give you a chance to brag on what you all are able to do and what your staff, because you did expansion in that building. You added some rooms and moved some things around, and talk about the expansion that you did in that building.
Yeah, so I have a great staff. I really do. So we respond to animal bites, so anytime an animal bites a human being, that gets reported to us. And not that we do a whole lot, but we do make sure that they understand the dangers of rabies. And rabies is still a thing. And it is, if you're bit by a rabid animal, it's nearly 100% fatal. So I always want to make sure that people understand, don't mess around with wild animals. It's especially bats. Bats carry rabies, and it's important that you get treated if you're bitten by an animal. And I would love to do shows about this kind of public health issues.
Talk about that. I think we can make that work.
All right.
I can't make a lot of things work. I can make that work.
Yeah, health happenings. I would like that. So then, we have preparedness, that have, we have preparedness plans for different events, that happen in our areas. What happens if we have a tornado, a flood, a zombie apocalypse, a pandemic, all of these things, we got to plan for that.
I like that zombie apocalypse came before pandemic. I like that.
Yeah. So, those are small divisions, but they are important. Part of our vital records division, we have a genealogy division, that will help people, get started if they want to do genealogy and look for records and things like that, as part of genealogy research. We have a new division that just started in that when I came over, and that's kind of our health education division. Kind of is a slow start now, but I wanted them to be way more active in doing, kind of the health happenings, and putting, a lot of stuff out there about diabetes and heart disease and women's health and all of this stuff on social media and TikTok and Twitter, and how not just, flyers and newspaper articles. We need to be looking at how do people consume information nowadays. It's different than it was, when I first started. If you got on your local radio station and in your newspaper, you'd hit 90% of your population. Well, now I don't know how you reach people nowadays. It's really, really hard. There's just 1,000 different ways that people consume information. So, I thought it was really important to have a health educator to do this. And and then COVID hit, and so we kind of, had to divert from doing that to being COVID 100% of the time. So we kind of pulled that off the back burner, and we've been press release full time, so hopefully we'll get back on track with all of that.
And for the health educator, and I know you talked about social media, you even talked about wanting to do a little bit earlier in this conversation, wanting to do classes and train people that are buying homes with septic systems and things of that nature. Do you have in your building a space where you might bring people in to do that kind of thing, or have you gotten that far in the planning with COVID having stopped everything? Some of this education that you're talking about doing, wanting to take it out more, wanting to bring people in more. What are your thoughts?
Yeah, when this building was built, we have a conference room, but post pandemic, I don't know that it'll ever be utilized as a public space. I don't know what post pandemic bringing people together is going to look like, to be honest. I mean, it's a very small room. I mean, I think post pandemic, I don't know, 5 people may be able to, it's very small when you think about a public space, but the commissioner's courtroom, sure, I could bring people there. There's lots of public spaces the county has, but things that I think about when I think about septics, there's parks, that you bring people to, and things like that when you want to talk about, how water moves through septic system and hydraulic loading of a trench, you want to do that outside. That's, the soil is the system, Eric. There's no better way to show them how water moves than to show them water moving through on the ground, so.
Well, but during your time here, this is not a side of you or conversation with you that we've had a lot of time to do. As I mentioned very early on, about 6 weeks after you arrived and everybody was saying, okay, we got a new health director, the pandemic hit, and a lot of our conversation with you has been about that. I think we spent a little bit of time once before kind of running through some of what you do, but because COVID has been, as you say, it has sucked the air out of the room.
Yeah.
Haven't really had a chance to allow you to talk about your vision for public health in Wayne County.
Yeah.
So
yeah, I would love,
wanted to do that. Wanted to get your thoughts on some of those things. Other than that, again, we're back around to COVID, but where you want to take this, how you want to inform the public, what you feel we need to know about public health is an important thing.
We'll get there.
I'm looking forward to that. We're down to our last couple of minutes. I'll wrap this up by giving you a chance to let people know what they need to know now. We have the Delta variant surging in Wayne and surrounding counties, and we know a lot of people come into Wayne County to do shopping, to do entertainment, to do a number of different things. It's part of Reed's service area. Reed's area is not just Wayne County, it's 8 or 9 counties surrounding us, including crossing the state line. So all of those people in some ways end up interacting and becoming part of where your concern is. So I'm going to let you talk to people about what we should really be watching out for over the next couple of weeks from a public health standpoint, how you would like us to move forward over the next couple of weeks. And just whatever reminder you feel you need to give people.
Yeah, I think that, it's time to indoors wear a mask, regardless of your vaccination status. Put your mask back on, especially if you're going into areas that are are crowded, grocery stores and shopping centers that are crowded, put your mask back on. If you're not vaccinated yet, now's the time, get vaccinated. Schools are back in. We're starting to see children having to be hospitalized. Don't wait till children are hospitalized here. If you're 12 or older, get vaccinated. Start using the non-pharmaceutical interventions, and that's social distancing, increased hand washing, and masking. These are the interventions that we know work. Let's start implementing them so we don't have to do more radical things like limiting, attendance policies, at events, like football games and things like that. We are yellow this week. My prediction is we will be orange next week.
Really? You're seeing that steep a rise that we're going to move from blue to yellow to orange literally in a 3-week period?
Yes. That's my prediction.
Okay. Well, ending on a high note there. Christine Stinson, Executive Director of the Wayne County Health Department. As always, I appreciate you taking the time to talk to us. We will work on getting you that show that your folks can talk about various things with the community. So we'll work on that one, and hopefully the pandemic will tamp down and you can turn your staff to more community education and things of that nature.
Yeah, I really get happy when I talk about septic. So really animated. Oh, if you really want to see me get excited, let me talk about a septic tank. Oh,
okay.
All right.
We'll set aside an hour or so and let you just do that. So get your slides, get your PowerPoint together, and we're going to deal with that.
All right.
Christine Stinson, Wayne County Executive Director, Wayne County Health Department. As always, appreciate the time. Thanks for being on In Focus. My thanks to Christine Stinson for agreeing to speak with me again. I know I echo her thoughts when I say that I hope that you will at least consider the idea of vaccination. It is causing our community some great issues right now. If you missed any of this program, replays tonight beginning at 10:30, also Friday night at 8, Saturday 8 a.m., 9 p.m., Sunday 8 a.m., 1 p.m. Audio replays available on G1013 and ESPN Radio 1490 and 100.9 WKBV. Thanks for watching In Focus on WGTV Channel 11. As always, I wish you well.